All right, good afternoon. We'll go ahead and get started. Welcome to the National African American Child and Family Research Center's Research Capacity Building Workshop. I am Latrice Rollins, honored to serve as the director of the center. This is the Research Ethics Around Community Participation in Research webinar, and we are honored to have our experts from Morehouse School of Medicine's Institutional Review Board, or IRB. We have Mr. John Smith, who has been with us for over 30 years, or is it 30 years? He's been with Morehouse School of Medicine. He serves as the director of our IRB. We actually have the only HBCU that has been accredited by the Association for the Accreditation of Human Research Protection Programs. So we are so honored to have him here with us to share his expertise. We also have Dr. Rhonda Holliday, who has many hats at Morehouse School of Medicine. She is a professor in our Department of Community Health and Preventive Medicine, but she also, for the purposes of this webinar, serves as the chair of our Social and Behavioral Research, IRB. So I am going to turn it over to them to share with you all. And please, again, feel free to engage with them in chat or ask your questions in the Q&A. Dr. Holliday, Mr. Smith.
Thank you, Dr. Rollins. Good afternoon, good evening, everyone. I'm so glad that you all could join with us today. We want to talk about some of the ethical considerations in community engaged research. I know I have been at Morehouse since 1990 and started in the Office of Sponsored Programs, where we were doing a lot of research in the community and a lot of research on the community. And since then, we have evolved to this community engaged research where we are looking to do things with the community, being a partner with the community. Our next slide, please. Community engaged research, or community-based participatory research. They are research approaches that integrate the community into every step of the research process. It's a shift from doing what we used to do, and that was research on or in the community, to doing research with the community. And we have found that to be particularly encouraging and uplifting for community-based organizations. We have some community-based organizations that have worked with us for a number of years, and now those community-based organizations have been able to receive their own federal-wide assurance. That's an assurance from the government that they will conduct research in a way that's compliant with the federal regulations. Some of them have their own 501(c)(3)s, and they are writing grants and getting grants funded. And this is all in partnership with Morehouse School of Medicine and some of our other partners. But what we're trying to do is to integrate into the community that they are an equal partner with the academic community. And that's very empowering. Next slide, please. This is a slogan that came from the people who were struggling in South Africa. And it says, "Nothing about us without us is for us." And that's kind of the motto that we have taken with empowering our community-based organizations, that nothing that happens in the community, if it doesn't involve the community, is for the community. And so we are just trying to kind of level that playing field so that community-based organizations who participate in research don't always have to look to an academic center for approval, but they can get to a point in their growth where they are the ones that are calling the shots. They are the ones who are looking to get resources and funding to do research that is of particular interest to that particular community. Next slide, please. So let me tell you something about the IRB, our Institutional Review Board. We have an IRB office, and we have two IRB committees, one that looks at biomedical or clinical research, and the second one looks at social and behavioral research. And our committee is composed of non-scientists, people who are not affiliated with Morehouse School of Medicine. We have physicians, basic scientists, nurses, we have behavioral and social scientists, we have public health experts, pharmacologists, and prisoner advocates, because we have been doing a lot of prisoner research over the years. But we also have the community. We have people from the community who serve on the IRB, and over the years, what I have tried to do is to have that community resident be reflective of the community that we serve. And in doing so, a lot of the IRBs who will have community members, they have people who are retired academicians or retired doctors. And I don't think that that is totally representative of the community. And so for years, I have looked to recruit and maintain community members, someone with a high school education, someone who has been active in the community or in the church. And I wanted that kind of representation on our board so that our board reflects the kind of research that we are doing and the people in that community. Next slide, please. So what does the IRB do? Our main purpose, our reason for living, is to protect the rights and welfare of human research participants, those individuals who volunteer their time and their talents, and sometimes their bodily fluids and data, so that we can do the kind of research that we do at Morehouse School of Medicine. And so to accomplish this, protecting the rights and welfare of human participants, we have to evaluate all the study documents that ensure that the procedures are in compliance with the local, institutional, and federal regulations. We evaluate the methods that you as a researcher will be using to protect participants. We look at things like risk, benefits, privacy, recruitment. Sometimes we will require changes to your research protocol. And all of this stuff has to be approved and reviewed by the IRB before the research starts. And then what we try to do is this serves as a guide from the day that you start recruiting to the time that when you have ended that study, you have written up all of your reports. And so it's not just a one-time approval, because we are monitoring this all throughout the lifetime of this research protocol. And so there are 3 golden rules that we use to evaluate how well your research is protecting human participants. Next slide, please. So when do you submit to the IRB? First, you have to determine whether or not your project is research. And research means that it's a systematic investigation, including research development, evaluation, and it's designed to develop or contribute to generalizable knowledge. And so normally with research, you might have hypotheses, there might be some procedures that you're going to do, or there's a statement up front that states that this is research. And so what we do, the first step here is determine whether or not your project is research. If it's not research, it might fall into a number of other categories, but that is something that the IRB will determine. Next slide, please. So when do you submit to the IRB? After you've determined that your project is research, the next question you want to ask is your project using human subjects? And a human subject is a living individual about whom an investigator, it wants to obtain either data through the intervention or interaction with that individual, or using their identifiable private information. Next slide. So the three golden rules I was talking about are, number one, respect for persons, beneficence, which means do good, no harm, and then justice, fairness. And we try to balance those when we are looking and reviewing your projects. That's intended to engage with a living individual or that living individual's personal identifiable information. Next slide, please. Respect for person. Everybody deserves to be treated with respect. People should be able to make their own decisions. The information that you are given needs to be truthful and accurate. And your participation in any kind of research is voluntary. You can sign up whenever you want to. You can withdraw whenever you want to. And one of the ways that we respect this, your decisions, is through this informed consent process. Next slide, please. Beneficence. We want to ensure that the risk outweigh the benefits. We want to be able to ensure that the researcher are minimizing any potential risk and maximizing any potential benefits. And if there are some known risks, we want to try to avoid those. What we're trying to do here is we want to do no harm to you. As many of you know that early on, before we had this National Research Act that protects human participants in research and led to the establishment of IRBs, is that people were recruited into research studies and not told that it was research. Or there were some known risks, but they weren't informed about them. And so this is our way of being beneficent in letting you know what you're getting into before you agree to participate in a research study. Next slide, please. Justice. Justice means that the benefits and the risk should be shared by everyone. And people should not be used out of convenience. Just because we are right here in Atlanta University Center and we have all these students there, we can't just recruit students because they are convenient. Or people shouldn't be able to come into your community and recruit you just because you're close to them. And we don't try to exclude people out of convenience. I think safety and welfare of others should not be risked for the benefit of other people. So justice is one of those pillars, the golden rule that we use when we are reviewing and approving and monitoring research involving human participants. Next slide, please. So what is the role of the IRB in facilitating community engaged research? One of the ways in which we facilitate community engaged research is offering CITI training, and we offer that free of charge to community-based organizations who are looking to maybe participate in research. We also have a lay training because the CITI training can be difficult for someone who hasn't been to school and been trained in this area. And so there is a lay training that's available, and there's a train the trainer option. There's also an online option, and participants will receive a certificate, and it carries just as much weight as the CITI training. For some community-based organizations who want to do research on their own or collaborate with another institution that might be doing research, because we are an accredited institution, our guidelines and policies state that if I'm going to be doing research with your community-based organization, your community-based organization has to have their own federal-wide assurance. And that federal-wide assurance is an assurance that we give to the government, the Office of Human Research Protections, saying that we will conduct research according to the federal guidelines and our institutional guidelines. And this also provides my interactions with a number of community-based organizations across the country, affords me the opportunity to recruit community members for my boards. And you would be surprised at the number of people who welcome that opportunity. And what we do is we provide our community members the same training that we do with our other IRB members. And we value their input as much as we do anyone else. And what they have to say is important. And we try to really make sure that they understand that what they bring to the table makes us better. And that's one of the roles in which we, as an IRB, facilitate community engaged research. Also, in terms of recruiting IRB members, I am always on the lookout for new IRB members. And if someone were to want to engage the services of Morehouse School of Medicine's IRB, and I will be talking to them, and the next question I'll ask them is, are you interested in becoming an IRB member? Because I found that IRB members make better researchers. If you are a researcher and then you become an IRB member, because you're going to be so well versed in the federal regulations and how to conduct research, you will become a better researcher. And so we have consulted with a number of organizations across the country to help them in their recruiting efforts to recruit not only community-based members, but also IRB members. Next slide, please. And Dr. Holliday is going to take over here and talk about some of the community engaged research and ethics that come into play and what we as organizations might want to be looking at or trying to do as we engage community-based organizations in community engaged research. Dr. Holliday.
Thank you, John. Right. So as John alluded to earlier, many times there have been many ethical violations over the years in different communities. And there have been issues of trust in the community. And so some of the common themes and problems that we see when engaging in community research is that communities can often feel coerced or experience undue influence when it comes to participating in research. So they may feel like they don't have a choice in terms of participating in research, or the incentive may be such that it's something that they really feel like they can't turn down in terms of participating in research. Communities have been lied to, quite frankly, by researchers and others when it comes to engaging in research. There can sometimes be an insensitivity from the researchers and their research team to the community concerns and issues. Some researchers are really focused on their own goals and end goals for their research without taking into account what are those concerns and issues that are of importance to the community. There are sometimes inappropriate methods that have been used for the community. Each community has their own set of norms, their own sort of individuality, things that need to be taken into consideration. And so what may be appropriate methods for one community may be totally inappropriate for another community. And so those are things that researchers need to pay attention to. And sometimes the benefits to the community are minimal. There may be a lot of benefit to the researcher in terms of their academics, careers, their institutions, etc. But what are the benefits to the community for participating in the research? What do they get besides a gift card? What are those benefits? What can the community get that is tangible from the research? Excuse me. Other common problems include stigmatization and marginalization of communities. By doing research with particular communities, there may be, I don't want to say opportunity, but there may be some stigmatization that comes about that could be based on the topic that you are researching. And so that could create some stigmatization of communities. So for example, I do quite a bit in HIV prevention research, and working with communities, there may be a chance that some of the work that I do can stigmatize a particular community depending on what I'm focusing on or who I'm focusing on. Oftentimes findings are not shared with the community. They just sit with the researcher when they sit in the ivory tower. And so those findings are not shared with the community. So they've participated in this research, but they have no idea what the outcome of the research was, what those findings were, and what those findings mean for not only their community, but how it may impact others. There's often a lack of capacity building within the community. And one way to address this is by having community participate, not just as research participants, but also as the study team. So how are you building the capacity of the community? And then, of course, there are those historical examples of abuse in research. And probably the one that is most familiar to most people is the what's known as the Tuskegee study, which led to our current regulations. So when we think about some of the ethical considerations in community participatory research, we want to think about ways that we partnership and collaboration and what that power balance looks like between the researcher and the community. We want to take in and consider what are the community rights, how are we going to manage conflict and have representation of the community on the research project. Another thing is ownership and dissemination of data. Who who owns the data? Typically, as a researcher, we think of it as our data, but if we're working with communities and collaborating with communities, who owns the data? Who has the rights in terms of dissemination of that data? How do you involve the community in dissemination of the data? So not just dissemination of the data to the community, but dissemination of the data to others outside of that community. That can be publications, presentations at scientific conferences, etc. Another ethical consideration is anonymity, privacy, and confidentiality. So one of the things that you have to consider and think about when you are working with communities, and you may have people from the community who are part of your research team, is really thinking about that privacy and confidentiality, the anonymity of the people who are participating in your research. You have people from the community on your research team. They are from the community. They know people from the community. And so while it can be a positive in terms of them having that familiarity with the community, that familiarity can also be a negative as well. And then the institutional review process is not always, institutions vary in terms of how they review and they view community participatory research. It's becoming, I would say, it's becoming more common for communities to be involved in research and involved in ways that are very collaborative, whereas that has not necessarily always been the case before. And so that presents some, I won't say dilemmas, but it presents some challenges for some IRBs in terms of how they review the ethical considerations of that research. And then sometimes there can also be a blurring of the boundaries between the researcher and the research, the academic and the activist. So becoming immersed in those communities, you can, veer into the role of being an activist. And so making sure that those lines aren't blurred between research and activists, and keeping those roles distinct and separate when it comes to your research. So some of the things addressing community-based research in the IRB application, what are some of the things you should consider? So the information that I'm about to present was actually framed in a way for what IRBs should consider. But I also think that it's really important for for researchers who are involved with the community, for communities who are involved with researchers, to consider these things as well when they're writing their IRB application. Excuse me. So we know that IRBs need training on reviewing CBPR protocols. And so this is something that you may want to talk to your institutional review board about before you even start to the process of having a protocol review that involves community engaged research. What experts do they have on the board? Do they need to find additional experts or search for expertise to actually review your particular project? The research should continue to identify problems with current ethics and review models as well as solutions, and IRB should support and incorporate these principles of CBPR when needed as well. One of the things that IRB should consider and that you as a researcher should consider as well is having an MOU with your partner. So that clearly defines and lays out what the roles of the researcher and the roles of the partner are going to be in this research process. And by having that, the IRB can clearly see that there is an agreement that you all have agreed in terms of what each party is going to do. But that's also a process in terms of you working with your community to really lay out what those roles and responsibilities are in your research project. So thinking about documenting the process for how your decisions are going to be made or how decisions were made and how the community was consulted can be a part of your application. And then for IRBs, just considering some alternative review guidelines for community-based participatory research or community-based research. That's not based on that traditional research model. So again, thinking about those issues of privacy, confidentiality, in terms of having people from the community participate as researchers. So in your IRB application, there are going to be different sections. And so some of you are probably familiar with the different sections of an IRB application and the information that you have to provide. So I'm going to go through some of those sections and have you all just sort of think about, these are some of the things that you should be thinking about when you are doing community engaged research. So one, is the research really justified? So is the research that you are proposing to do, that you've received funding to do, you've justified it to the funder, but is it really justified to do that research with that community? So the funder may not have considered some things in terms of justification with that community, but thinking about the community that you are working with, that you're collaborating with, do they see that the research is justified? And if you have a true collaboration with that community, there should be some evidence that that research is justified, that they have had some input into that research. Thinking about who benefits and how they benefit. So again, thinking about the fairness of the research, how is the community going to benefit? Who in the community is going to benefit from that research? And then also, how is the community involved or consulted in defining the need? So you may be researching a particular issue. Is this really a need of the community? How did you go about determining that this is something that the community was interested in? How were they involved and how were they consulted? Who came up with the objectives of the research study and how did you come to those decisions? And then are there concrete action outcomes? So at the conclusion of your study, are there any action outcomes? There may or there may not be, but are those things that you have considered in terms of the outcome? And it could be that you just want to share that information back with the community that you learn. And then in terms of the risk and benefits, what are the risks for communities and or individuals? So again, thinking about we typically tend to think about risks and benefits to the individual who's participating. But again, there can be risk and benefits to communities themselves. So again, thinking about that stigmatization and marginalization that could occur based on the topic that you are researching, based on whatever your research topic is. What are those risks to the communities? What is the risk to the individuals in that community? Be honest about those risks and consider how to minimize them. And then are there built-in mechanisms on how unflattering results will be dealt with? No one wants to be viewed in an unflattering light, but have you thought about and have you discussed with the community, or are there ways that you can talk to your community about any results that may be unflattering and how those results may be dealt with? They may not want the results to be published anywhere or disseminated anywhere, but it may be necessary to have those results disseminated. So how are you all going to come to that decision and to that mutual decision that these results will be disseminated? What will that process be? And then be clear about who benefits in the research and how they benefit from the research. Okay. Informed consent. So what does it mean for what we call vulnerable populations? And vulnerable populations can include people such as children, the mentally ill, those who may have developmental disabilities. Vulnerable populations can also be students. We think about we're in an academic institution. We have students that are that can participate in research, but what does it mean for that student to participate in their professor's research? What does it mean to inform? How are you going about informing people about what your research is about? Are they understanding what it is that that you want to do? How are you informing them? How are you assessing whether or not they understand the information? And then what does it mean to consent? So consent, how are we assessing that they truly understand and are consenting to everything that is going to be done in this research? And then how do you do this in a culturally sensitive manner? Again, considering your community, their cultural norms, making sure that you are operating within those cultural norms and that you're being sensitive to things that may have occurred in the past in that community and taking that into account. Whose permission do you need to talk to? And when do you need to talk to them? So again, thinking about, in some instances, it may be that you not only need to get individual consent, but prior to, you need to get community consent, or as part of that process, you need to get community consent as well. So again, just thinking about those things. And once you start to have conversations with the community, with community members, some of these issues will start to be worked out. So privacy and confidentiality. So how do you maintain boundaries between multiple roles? So role as a researcher, a counselor, a peer, someone who's part of your research staff, but is also a member of the community. How do you ensure that that privacy and confidentiality is maintained? And then what processes will you put in place to be inclusive about data analysis, yet maintain privacy of those participants? So if you're having community be a part of looking at your data, they may not be involved in the nitty-gritty details of the analysis, but you run the analysis, they may look at the data, or they may have access to that raw data file. How are you going to maintain the privacy of the participants? Where would you store the data? Back in the day, we used to store data in file cabinets, paper data, but most of us now are not operating with paper data. So data is typically stored on a computer that's password protected, that has firewalls. Making sure that that data is stored in a place that is safe and cannot be easily accessed. And then who on your research team will have access to that data, and how will they have access to the data? How will you determine who has access to the data? And what rules will you have for working with transcripts or surveys with identifying information? Again, who will have the ability to look at those transcripts, to look at those surveys? Are you going to de-identify the transcript of the survey before having someone else look at it? Compensation. This is always can be a hot button issue. So we do want to reimburse people for their time and honor their efforts. We want to make sure that the reimbursement or the honorarium that we're giving them, the gift card that we're giving them, does not promote any undue influence. Okay. So typically we think about things such as providing travel and childcare for them. Excuse me, for study participants. But we want to make sure that whatever we're providing for them is not going to have them consider participating when they would not have considered participating. So it's not going to be something that is going to influence them to participate. And how do you determine what that line is for a participant? And again, that's something that you may want to talk to your community about. You again want to make sure that you are considering people's time and effort and honoring their time, but also making sure that you are not crossing the line into undue influence.
Hey, Rhonda, that's a very good point you just brought up, because we've had instances where for some studies, participants were offered in excess of $500 to participate. And people were looking at the dollar amount that they would receive and not taking into consideration the risk involved in doing that. And so it's up to the IRB to determine if the amount of money or compensation that some individuals receive, would that be considered to be coercive? And if doing so, we have asked investigators to reduce that amount so that it was not as coercive as was before.
Mhm.
Go ahead.
Okay. When it comes to budgets, are partners being compensated for their participation or their role in the project, and who is managing that budget? So who is getting paid? Who is volunteering? How are those decisions made? I think one of the things that that comes up when you're doing community engaged research is making sure that you're adequately compensating those who are providing a service to the project. So if they are a liaison and they're connecting you with community members, they're helping you to recruit. Are they brought on as an employee? Are they brought on as a consultant? What's the fair compensation for the activities and the work that you're asking them to do? If they're volunteering, should they be volunteering or should this be a paid role? And how are those decisions made? So conflicts of interest, what happens when your job depends on the results? So as a researcher, we are keenly aware that when we're doing a research project, we need to collect data, we need to get results. And for some people, this can factor into whether or not they get tenure. So what happens when your job depends on the results? As a researcher, it is our responsibility to make sure that we are being ethical in terms of how we conduct that research, in terms of how we work with the community. And so just always keeping in the forefront the ethics and engaging with integrity with the community and your research. And then what happens when you are the researcher and you may be the social worker or the doctor, the nurse, the service provider, etc. How do those roles interact and intersect with one another? How may they conflict with one another? If you are the clinician and you're enrolling your patients into a project, how are you going to minimize that conflict of interest, reduce that feelings of coercion and undue influence? So in terms of participants, just want to make sure that you are talking to the right people to get your questions answered appropriately. And how, again, will you protect those vulnerable groups if you are working with children, people who may be experiencing incarceration? How are you going to protect them and make sure that their rights are protected? Will the research process include or engage marginalized or disenfranchised individual? If so, how? How are you going to go about engaging them? How are you going to make sure that they will not be taken advantage of in any way? who speaks for the community? So this can be a tricky one as well. Sometimes you have to be careful in making sure that you have the right individual or individuals who are representing the community. Knowing the lay of the land of the community, knowing who community members trust. Sometimes people will present themselves as trustworthy in the community, and they may not actually be the person that you need to trust, or the person that the community trusts. And then is there a reason to exclude some people, and why? Make sure that you can justify why you are excluding or including people.
Rhonda, let me just go back to who speaks for the community.
Mhm.
Some years ago, I was approached by a manufacturer of synthetic blood, and he was trying to get me as an IRB to provide him with a blanket consent to use this synthetic blood at Grady Hospital for individuals who have been traumatized, who had been shot, who had been in a car accident or things like that. And he wanted to get permission from the IRB at Morehouse to provide that blanket consent for their community. And I told him I couldn't do that because we would have to get people from the community who are really impacted by this situation to agree to that. And so it's very important that the right people be contacted and considered when you are trying to get consent from the community.
Mhm. So in terms of recruitment, you want to make sure that you are using the appropriate recruitment strategies, that they are culturally relevant to your community. You always want to consider that privacy and confidentiality, and also consider any power dynamics that may exist within the community. Um, so oftentimes, again, we do have community as staff, and so they have to go through our human subjects training, our ethical training for engaging in research. And so, as John mentioned earlier, there are some lay trainings for community members. And so two of these I have, and you'll get the slides, you'll be able to go to these websites. We use certification, which is from the University of Illinois at Chicago. And this is a training that we typically do in person, but they also have an online module. It's about a 3-hour training. There are three separate trainings. I'm sorry, 3 modules. And then there's another community lay training that is called Community Partners Research Ethics Training, which is out of the University of Pittsburgh. And this particular training really allows you to customize to your needs of your project. So some of the ethical issues in terms of having community as staff that you want to be attuned to can be research misconduct, falsification or fabrication of data, and knowledge of these activities, research protocol violations that can affect the data integrity, and then also that confidentiality and voluntariness. So making sure, again, that the data is remaining confidential, that people are voluntarily enrolling in the project. And I will say that these are issues that not only you want to make sure that are not exclusive to community members as staff, but your research team as a whole. So you have to make sure that the entire research team is being trained on these issues, so that the integrity of your data remains and that your relationship with the community remains intact.
Rhonda, we have some juicy questions that they are asking, and we want to leave a little time in order to answer some of these questions. So you want to go through some of these?
The Q&A, yes.
Okay. Lisa Marshall is asking if you have a potential research study, how do you submit? We do, if you're going to be submitting that to the Morehouse School of Medicine or to any IRB, normally that they have a submission process. Here at Morehouse School of Medicine, we have some information on how to submit your projects. And we will share that with Dr. Rollins, and she can share that with you. But it's all online, and it's easy to do. We do ask that before you submit anything, that you take your human subjects protection training, and that from there you register on our electronic submission system, and then you're submitting that information to us for review, and then we can respond in kind to that. Ella Henry wants to know what do you find are the best practices for recruiting community members to be part of the IRB? I recruit IRB members even when I'm going to doctor's appointments and talking to people. I can find IRB members there, or at church, or at the farmer's market. I just began talking about what I do, and people will tell you what they do. And, so that's interesting. Would you be considered to be, why don't you sit in on one of our meetings and see if this is interesting for me? Because that I was invited to sit in on an IRB meeting, and from there I was hooked. So, but you can get with me offline, and I will be happy to share some additional best practices that I think are ways in which you can recruit IRB members.
And I would also add in there as well, researchers that you know at your institution who are doing community engaged work often know members of the community and can make recommendations for members of the IRB. I actually made a recommendation for one of our members of the IRB, and he's still serving. He's been on there for a few years now. But talk to researchers at your institution who are working in the community. They know who may have some interest in serving on an IRB. So yeah.
And then Mary Wilson wants to know, does the guidelines and rules of engagement that you are sharing apply to general research, or is this for human research, subject research only? I think the IRB deals particularly when research involves human beings. So ours, it would be when human subjects are being recruited. I'd like to get a little more information on what you mean by general research.
Awesome. There was another question earlier on in the chat, and so someone asked, research is a very rigorous process, and continued involvement of the community members may not be possible due to their other commitments. What are the ways to overcome such issues?
I think one of the best way to do that is upfront. I think what the person who asked this question is talking about is what to me would mean that I have come to the community with an idea that I have for some research, and so the community is really not involved in developing that research question or talking about something that is important for the community to be involved in. And so I think that when we have interest in a particular topic or subject, we will make the time to be involved in that and be invested in that. And so I would say, number one, make sure that when you're developing your research question, have those communities members involved in that. And those individuals, I believe, will stick with you throughout if it's something that's important to them.
Mhm. And to add to that, I would also just sort of reiterate the importance of having that MOU, making sure that everyone understands what their roles and responsibilities will be and what those roles and responsibilities are. And then also, again, engaging in having that continuous dialogue with the community members. So depending on what role they may be serving on your project, if it's in the role of the community advisory board, or maybe they are working as part of your research staff, keeping the lines of communication open with them, so that if there are some issues that come up, that you can address those issues. But also, if you're having those conversations with the community as a whole on the front end, if someone has to leave the project, going back to the community and engaging them to find a replacement, whether it's for your community advisory board or for your staff. Community as research participants can be a little bit trickier, but yeah, having that, just to staying engaged and having those conversations with the community from the very beginning of your research process.
Awesome. Well, I definitely want to thank Mr. Smith. I'm always about to say Dr. Smith. Mr. Smith and Dr. Holliday for sharing with us. As I had shared earlier in our introduction, this is a stellar team that gets and understands community engaged research and has been working with researchers like myself who have community members as co-PIs and community accountability boards and, just various ways that we have engaged community. And so I hope that this has been informative and helpful for you. And definitely, again, want to thank Dr. Holliday and Mr. Smith for their time. And make sure you register for next month's webinar. We will be back next month talking about measuring equity. So again, thank you all so much for your time, and we'll be in touch. Have a great one.
Hi, thank you.
Bye-bye.